This is to avoid Medicare fraud and to just have, you still have a choice of like how many different companies. Like, it's not just Lincare or Roberts or Apria anymore. Before there's, I would say, about 20 to 25 companies out there. Now I think it's about 10 that can provide Medicare services. You can go to the next one. They started competitive bidding in 2011. There were 9 markets that they basically tested, and they saw that it worked for them. Basically like fraud went down, but we only started this in 2013. There's 91 additional markets, and Richmond is part of that. That's why some of you may have gotten letters like in April about, hey, you have to find another provider. We are not going to be in business anymore, or we're not a contracted Medicare provider. So some of you may have gotten that letter. And when you got that letter, you called your provider and said, hey, I want to go to this company now. So we would get like your medical records, and we've noticed that when we got medical records from, patient A, and patient A has been on oxygen for like 2 years, and when we get their medical records, we are wondering how come this patient got oxygen, because not everything was done right. Not everything was done by the book. So it got really frustrating that we actually had to go to the physician's office and tell the physician, this patient has been on oxygen for 2 years, but we don't have the proper documentation to bill Medicare. So that's why some of you have gone back to the doctor's office to get re-qualified for something that you've been using for the past 2 years. And that's why Medicare did this, because a lot of companies out there are just dispensing this oxygen equipment and getting the reimbursement, but it's not done correctly.
And the theory is that there were people out there dragging these tanks and sleeping with the cannulas that didn't need it.
No, they need it, but they don't have the proper documentation for it. Meaning, like if your testing was done on exertion, they didn't have the testing where they walked you again with oxygen. Or if they have the right, they don't have the right diagnosis to bill for the oxygen. So those things. Or they haven't been seen by the doctor within X amount of days. So your physician ordered it for a reason, but what your physician says and what your insurance company says can be 2 different things. Does that make sense?
No.
Your doctor says you need the oxygen. You qualify. He says you're 87% while you're walking. But your insurance company says, no, that's not sufficient to bill for the oxygen. I want you to test your patient walking with oxygen and how they're doing sitting down. So those are the things that, what your doctor did wasn't sufficient to bill for your insurance. And some companies, what they did is they just gave the patient what they need, thinking that they're not going to get audited for it. Lincare is a big company. We get audited a lot. Roberts, they are a big company. They get audited a lot too. So that's why you want your oxygen provider to do the right thing from day one, so you don't have to go back and redo everything again. Does that make sense now?
I hear what you're saying. It doesn't make a lot of sense.
Well,
Okay.
some people,
It's Medicare.
oxygen companies selling fictitious oxygen. Had people on the oxygen that weren't people.
Didn't exist.
CPAPs and so on.
Mm-hmm.
And by making all these rules, by the access document that there really is a person that's getting this gizmo, then there's less chance of fraud.
I mean, that's why, there is a lot of fraud out there. There is. And I didn't believe it until I saw the documentation from some companies come to our office and were like, what is going on? That's why we do that conversion process. That's why we check before you can switch to to a company. Because we want to make sure that we can bill and we can bill correctly and not just take the money from Medicare. Because if if you get audited, you have to give that money back. You want to add something?
I guess I have a slightly different take on this. So, I feel like what Medicare's doing now, they're trying to save money, obviously. A lot of things that she's talking about, like the third test, that they're auditing our charts and saying this wasn't done, we're gonna take our money back. Well, the reason it wasn't done was because they weren't enforcing it 5 years ago. So nobody did the third test 5 years ago. So it's not, I'm just gonna say, I don't consider that fraud. I consider that a documentation technicality that the physicians did, and now we're paying for it because the physicians didn't do the documentation correctly. We're really at the mercy of your
And
physicians.
you're caught in the middle of what you,
Right.
you and Lynn Care.
So we're doing, I mean, it's happening to our own patients.
Yeah,
They'll hit the 5-year mark, we're sending them back, we're getting them requalified, and then we look back and go, dang it, we don't have that third test from 5 years ago, because back then, we didn't ask for it, because we didn't know it was gonna come back and we were gonna get audited on it. So we're having
There's no statute of limitations on that, you just.
they can go back and audit, how
Do
many
it all
years?
over.
7 years, something like that. They can go back and audit. And then what they can do is go back and say, we're gonna take all this, so
They
you
can
may
just
need your
deny it.
oxygen, but
Yeah.
because we had one Medicare denied a claim because the doctor, when he signed his name, and this is a true story, he did not write MD after. And they denied the claim. Now, we'll get the money back after we appeal it, but it's still, they're holding our money because of a technicality. So it's not all fraud, there is plenty of fraud going on, but a lot of it also is, they require so much documentation now, it's really difficult to get it all correct all the time.
And they keep changing. Like, seems like there's a new rule or a new reimbursement cut like every 6 months, and we just have to deal with it. Yes.
I worked at the VA hospital as a respiratory therapist and as a home oxygen coordinator. Back then, back in 1996, we found that the oxygen company that they had were getting paid for patients that were dead.
Oh, my goodness.
And they had to change that. And that criteria went on into Medicare. We also did rest oxygen, exertion, and sleep. But you also had to put the oxygen on to find out how much oxygen you need, whether or not it's 2 liters, 3 liters, or 4 liters. You just can't put a standard 2 liters for everybody. So we made up the criteria at the VA hospital because of what happened way back when. There was a whole lot of oxygen companies just, dead patients. So everyone's at fault, even with regular doctors. If I have COPD, that code has to be 969 or whatever the code is for that. It's not just oxygen, it's not for, just certain people, it's for everybody. They will not pay unless you give them the proper code. They have a big, huge code book just for that.
Yeah, and I don't know, we, like Lynn here, whenever we've run across this problem, like a physical therapist, like when they're out of the hospital, they would document, and it's a semantic issue now, they would document oxygen after walking back to room was 87%. It can't be after walking, they said it has to be during walking. So, they had to redo that, and And like, that's why we have to check to make sure that it's properly documented to avoid getting it kicked back from Medicare.
And the proper numbers.
Huh?
And the proper numbers.
Yep. Yeah.
Well, what a fantastic job. Great.
Whew.